Very rarely is there education on how to talk to somebody. And we've noticed that that's really important.
As a first and second year student, you don't really get a lot of clinical time. It's mostly kind of studying in books. So when we get to come in, practice doing a history, practice parts of the physical exam, it's invaluable to us.
So like an emotionally charged scenario, you don't know how you're gonna react. You know, you need to be better prepared when you deal with that in real life. You have to be strong for your patients to better inform them so they could be prepared for what's going on.
It can be somewhat difficult to teach those skills, but having someone who's objective, having someone who can tell them how it felt to hear certain words, has made the entire experience a more positive experience for the trainees.
So based on the ultrasound that we did, we think you have something called placenta previa. All that really means that the placenta attached lower in the uterus than we would like it to, and it can kind of cause some of this bright red bleeding you were having earlier this morning.
Okay.
So what we're gonna do is your baby looks really good, but we'd like to admit you and just go ahead and keep monitoring you.
Okay.
We've realized that this was a gap in the education of the fellows, critical care fellows, that they didn't get education in how to communicate difficult topics. And so we approached the School of Nursing as well as the School of Medicine and came up with a curriculum that utilized standardized patients to be able to help teach those important skills.
It's some of the best interactions that we get as a first and second year medical student, and then it even evolves as we turn into third years.
As a nurse now in my practice in the ED, I feel like those experiences help me know how to reduce my anxiety and really be present for my patient and communicate to them clearly what's going on.
So our thought process right now is that she could have a few diagnoses, which is why we want to do further testing.
I think it would have been a great idea to give her, the mother, a better understanding of what the hemoglobin was, the platelets, hematocrit, and exactly what they do for your body.
When they've had to have that conversation in real life, it's changed the way they feel about having that conversation.
So I definitely believe this has been beneficial with the 2 C's, your confidence and your competence, to help you be a better provider for the world out there.
It really does simulate something that we're going to be doing on a daily basis, then also for our examinations as well.
So going through these simulations with standardized patients really lets the fellows feel that they can do this. They can do this in real life with a real patient, with a real family sitting in front of them.